Now, my career before I was elected as Hayward and Middleton's MP was as an NHS clinical scientist. Working in a biochemistry laboratory, I was very familiar with sodium valproate as part of the battery of anticonvulsant drugs for which we regularly tested patients in order to help their clinicians better monitor their treatment and ensure that their dosage was at the optimum level. However, until I met Emma Murphy and became aware of her campaign, I was not aware of what appears to be a systematic failure to inform women of the potentially damaging effects of taking valproate during pregnancy. Now, Emma herself only became aware after watching a television programme about fetal anticonvulsant syndrome that her own children's health problems were probably attributable to the anti-epileptic drugs she had taken whilst pregnant, which had been prescribed to her from the age of 12. And like everyone, I think, in the House today, I'd like to pay tribute to Emma Murphy and Janet Williams for the great campaigning work that they've done and that they continue to do. The damage to the developing fetus is thought to be caused in the first trimester of pregnancy, when the anti-epileptic drug crosses the placenta into the fetus, and the effects depend upon both the dosage and the drug. But sodium valproate, or Epilim, is indicated in 80% of cases of fetal anticonvulsant syndrome. And experts such as Dr. Peter Turnpenny, clinical geneticist at the Royal Devon and Exeter Hospital, say that Epilim may affect around 560 babies every year. He goes on to say, and I quote, "About 10% of fetuses exposed to sodium valproate will have a major congenital malformation such as cleft palate. 12% are likely to be diagnosed with a neurodevelopmental disorder." Reports linking valproate to birth defects started to appear notably in 1981 with a paper by H. Now entitled "Sodium Valproate and its Metabolites." The British Medical Journal published an article in 1983 from the Royal Liverpool Hospital citing 2 cases suggesting a link between birth defects and valproate taken during pregnancy. The American Journal of Medical Genetics cited 7 cases in 1984 of children born with malformations to mothers taking valproate. The Journal of Paediatrics cited 26 cases in 1986. And the list goes on. And it would appear that the evidence was steadily building up with the publication of more and more cases linking valproate to birth defects. The Committee on the Safety of Medicines and the Medicines and Healthcare Regulatory Agency noted these reports and, I hope, monitored valproate, particularly in pregnancy. Certainly I'll give way.
With all of these various scandals, the member for Newport West mentioned Vioxx, where trials have not shown a problem and it's the real-world use that shows a problem. Does the Honourable Lady think that we need some kind of reform of the reporting system? We call it a yellow card. It is now that patients can fill it in themselves, but many of them don't realise that. And I just feel there's not enough flagging up that actually a patient is suspected of having a side effect.
Thank the Honourable Lady very much for that intervention, and I think she's absolutely right. She's well aware of the yellow card system. I'm well aware of the yellow card system. We've both worked in the NHS, but how many people out there know that they can report side effects of drugs, or even if they've got a suspicion? And I think we really have a job to do to get that message out to the general public. And also we need to have people who are going to collate that information and act upon it. So thank you. Now, the definitive paper stating that there was a clear link between valproate taken in pregnancy and birth defects was published in 1995, entitled Fetal Valporate Syndrome, and it was written by geneticists at St Mary's Hospital, Manchester. So it's clear that the evidence has been building up for a long time. So why does it appear that women were not warned about the potential dangers of taking the drug in pregnancy? Certainly.
To quote from that 1995 report, the study concluded The risk of fetal valporate syndrome when babies are exposed to valporate is significant. Significant.
Yes, and I think that was probably the first paper to say this isn't just coincidence, this is actually a causal relationship. And for that reason, it is seen as a definitive research paper. Now, many people have already mentioned the pharmaceutical company, Sanofi, and they have stated that they have kept in line with scientific knowledge when reporting side effects to the fetus. But from as early as 1983, the Committee on Safety of Medicines and the MHRA reported on the problems caused by taking sodium valporate in pregnancy, but did not insist that Sanofi issued warnings in the form of a patient information leaflet. And even now, to this day, epilepsy charities report that women are not aware of the potential risks when taking the drug in pregnancy. And I know this survey has already been mentioned, but I don't think it does any harm to actually try to reinforce these findings. The survey showed that 18% of women taking sodium valporate were not aware of the risks during pregnancy, and 28% said that they had not been informed of any risks. And this is despite the MHRA producing the Valporate Toolkit, which is designed to help healthcare professionals talk to women with epilepsy about the risks of taking valporate during pregnancy. Certainly I will, yeah.
I'm very grateful that she's making an incredibly valuable contribution. Would she agree with me that if it's clear through a period of time that the amount that it's being prescribed is significantly more than the guidance would suggest was appropriate, that it's not acceptable for the drug company, for the regulator and government simply to be passive and to allow that to continue? If we know it's being overprescribed, and it appears to be the case, why on earth wasn't action taken?
I thank the Honourable Member for that intervention, and I think that's a very good point. And I think that's a point, if we do manage to establish an inquiry, I think that's an issue for the inquiry to look at about the overprescribing of this particular drug. I also want to mention other agencies. The European Medicines Agency have also recommended a strengthening of measures to reduce the risk of harm to babies born to mothers taking valporate. And information from the House of Commons Library outlines a situation in France, which has already been referred to, with an estimate that between 425 and 450 children were affected by birth defects attributable to valporate from 2006 to 2014. And the French Parliament this year voted to set aside €10 million for claims related to valporate, which the Health Minister, Marisol Touraine, described as a starting point. And she stated that compensation would ultimately be paid by those deemed responsible. She said, "I regret that Sanofi didn't seek an amicable settlement as a matter of principle. I hope Sanofi will change its position." Sanofi had no comment to make on the Minister's remark. Additionally, a class action has been brought by the French Association for People Affected by Sodium Valporate against Sanofi. In the UK, in 2004, a class action was brought by a group of families under the Consumer Protection Act 1987, which was expected to go to trial in 2011, but the litigation was discontinued prior to this after the Legal Services Commission withdrew funding. Now, it's disappointing that this government have said that there are no current plans to introduce a compensation fund similar to that in France, and I would urge the government to reconsider. I fully support the remedial steps outlined in the motion, including the call for an inquiry, and this government must bring forward a care plan and financial assistance for the victims of this national scandal. Thank you.
Thank you, Mr Deputy Speaker. Let me begin by congratulating my honourable friend, the member for Norfolk North, for securing this important debate on valporate and fetal anticonvulsant syndrome. It is an important debate and one I hope will compel change. I'd also like to join my colleagues in putting on record my thanks and admiration for the Facts Association founders Emma Murphy and Janet Williams, who are here today. Emma and Janet are an inspirational pair, turning their life-affecting experiences as victims or knowledge of victims of this syndrome towards justice on this issue and a demand for better knowledge of the risks sodium valproate poses our unborn children. I speak, Mr. Deputy Speaker, as someone who, for 10 years or so, took sodium valproate, not in utero but in childhood. At 7 years old, I was rushed to hospital with meningitis. Within a few hours, I was fighting for my life and in a coma for 2 days before responding to a spinal tap. I was one of the fortunate ones and survived without any of the known side effects, as deafness, blindness, amputation or death are routinely followed when suffering from meningitis. Instead, I was left with epilepsy for the 6 years that followed. I got pretty close to the NHS, its outpatients, its outpatient wards, the brilliant teams of nurses and doctors who worked together to get me better. I was prescribed sodium valproate, and I took Epilim, which I dutifully took, for at least 6 years. So I stand also to give voice to epilepsy sufferers in this country. Let me give you a sense of what it is like to endure a convulsion. There is a stillness at the control centre of your mind, but a violent movement of the body. An arm, the head, or legs. You are aware of it, but unable to prevent it or stop it. You can, I recall, steer it, though I would not know how that is so. I remember now, as a young boy, as with most siblings, enjoying bunking down in a bedroom with a fellow sibling, and in fact being able, in the very rare occasions I had convulsions only ever between the hours of 4 and 6 a.m. in the morning, managing to wake my sister, for whom we had enjoyed a sleepover in one of our bedrooms. She alerted my parents, and I was really observed until this convulsion stops, because there is nothing you can do. Epilim, sodium valproate's commercial name, is widely thought to have been the greatest contributing factor in curing me of epilepsy. But for a simple twist of fate, my consumption of this drug may well have been at a different time. When presented with the National Archive papers of minutes from 1973 and 1974, when decisions were taken to withhold the knowledge of this risk to fetal development by Emma and Janet, I was stunned. Notes in these meetings, in the minutes 1973 and 4, advising 2 consecutive different governments not to include any warning or information on the risk. This is all too familiar. Another national cover-up, further scandal from those closed decades. The we know what's best for you approach taken by the few to the many, and has been said very often by men to women. The long wait for social justice and a burning injustice finally coming to light. A conspiring against the women for whom they were prescribing. So I do not rise to spread fear, but knowledge of sodium valproate. I stand here as record of its effectiveness, but I do not stand up without remembering the unborn children, the women and expectant parents for whom the risks are not widely enough known. So I welcome the warnings will feature on the outside of packaging and hope from here our medical leaders and the government will appreciate the issuing of guidance, but recognise that the issuing of guidance is not the same as ensuring knowledge. I wholly support practical steps, the distribution of the valporate toolkit to all clinicians, pharmacists and women prescribing the drug. But the government has a duty to respond with practical steps to address this problem, because our fight is as much with the cover-up as it is for the clear picture we need to send parents where mum is taking valporate. Let this be another moment where we draw caution for all those in positions of power, for whom they're about to make decisions that keep people in the dark, withhold information that's life-affecting, life-changing or poses risk to life. Life will catch up with you. The good will out. It is the mark of an open and tolerant society that we are all here to steward, where freedom, equality of access to information is a guiding principle to life in it. And on health, not decisions made for us, but decisions taken with us. Nothing about us without us. A democratic voice at the table, an informed patient choice, not deals in the dark. We've a democratic deficit in decision-making on health matters and services. And sadly to say, on evidence of last night, there's a democratic deficit from this government too. A government listening, they say. We've a government that refuses to hear, is what I think. So I urge the government to listen and hear us when we say, make amends for this national scandal. Look at compensation. Address the lack of knowledge. Apologise to the women and children who are now men and women themselves. And make clear our instruction from here that no content or information pertaining to health and medical prescriptions and the decisions for patients to make is ever withheld again. Thank you, Mr.
Jim Shelby.
Thank you, Mr. Deputy Speaker. It's always a privilege to speak in these debates. I make a special consideration for the honourable gentleman from Bury North, who just gave a very personal but a very, I believe, a very powerful personal summary of his life, and we appreciate that. It has added to this debate greatly, and I think all of us who heard that debate and his contribution will greatly appreciate that. We want to say thank you. Also to the honourable member for North Norfolk, who set the scene so capably, so well, outlined the very systematically the case for addressing the issue of valporate and fetal anti-convulsant syndrome. I also would pay credit to his summary at the end, which I'll speak about later, but and the 8 recommendations that he put forward, and if there were 8 recommendations to follow, those are the recommendations, and I think any of us in this House would adhere to that. And can I also thank all the other right honourable and honourable members who spoke, because their contributions were equally important and for this House, and the interventions as well. I always think that the House speaks and probably shines better whenever we have issues where we can all have an input into, from a personal point of view, on behalf of our constituents, and this is one of these issues. There is no greater gift from God than that of a little baby. I have 2 wee granddaughters, and we adore them. We don't maybe spend as much time with them as perhaps we should have. Maybe we don't spend our time with our children, but with our granddaughters we try to, and they're both perfect. Certainly, in my opinion, they're perfect, even though they might have some tantrums. And being wee girls, maybe they have different tantrums, because I only had boys, so I only reared boys, so I wouldn't have knowledge of both. But I watched my parliamentary aid, and I want to make this point. as she refused her normal 10 cups of coffee. And we live in coffee in my office, and probably maybe in everybody's office, I suspect. But she drank only caffeine-free beverage for 9 months during her pregnancies. Indeed, it was my first indication, I have to say, that she was expecting again whenever she wasn't taking coffee. But it told me something. Here was a girl who had 2 miscarriages, who had 1 baby and was expecting her second one, and she was going to take every step that she could to make sure that the baby was perfect. The reason why she didn't take the caffeine was, she said, that the baby's heartbeat would be a little fast. So mothers will do almost anything to ensure that they protect their little life when they know of its existence. That's what mothers want to do in this house, outside of this house. But unfortunately, this debate has illustrated very clearly that some of those mothers didn't know what was happening. And that's why I feel so strongly that there must be more research done for those mothers who have the long-term health problems and who do not know how the medication they must take to deal with this may affect their children. Every member who has spoken has illustrated that. And I just throw this into the equation because I'm aware of this as well. I think of those who have ulcerative colitis and Crohn's disease, amongst others, and who are on infusions such as infliximab, who have to come off these if they want to get pregnant. So there are things there that are told to some people, but did every person know that? I suspect they didn't, but I think they should. And I think it goes back to some of the interventions by the honourable member from the Scots Nationalist Party, who referred to the yellow card, and the honourable member who spoke to that as well. Those are incidents where people need to be aware of. More needs to be done to ease the mind of these families. And that's why I join with my colleagues today to ask for more to be done in the case of this epilepsy medication in particular, but more long-term medications in general as well, because I think we have to look beyond this debate and encapsulate what other people are saying. Sodium valproate is an epileptic drug that is associated with greater risks in pregnancy than the AEDs. There are other valproate medicine, for example, the valproic acid and valproate sodium. The Medicines and the Healthcare Products Regulatory Agency report that whilst the general risk of a fetal abnormality is 2 to 3%, in women taking sodium valproate, the risk is around 10%. Did they know that? This debate, I think, Mr. Deputy Speaker, would illustrate that they know they didn't, but they should have, and we have to address the issue as it is now. The birth defects can be spina bifida, malformation of limbs, and facial and skull malformations. It also states that the use of sodium valproate in pregnancy can affect a child's development. And many members, and the powerful speech by the member for Bury North tells you exactly what it does in this House, as said by himself and by others. It delays in learning to walk and talk, and lower intelligence. Again, other members have referred to that, until in the same age and poor speech and language skills. We've had many unfortunately, scandals over the years. The thalidomide is one that I can relate to because of my constituents who have come to make me aware of it. The honourable lady who spoke yesterday in the mesh implants debate in Westminster Hall, which I spoke on as well. I was contacted by a large number of those, but you know something? They didn't know that either. They didn't know what was going to happen to them. But yet and all, they had the repercussions of years and years. There was one honourable member referred yesterday to a lady who had to go in 3 times over 2 years, over 6 years it was, to get operations before they eventually got cured. And primitus as well. I mean, I was talking to one of the honourable members who's not here, and he was referring telling me that he had been involved in this one. So there are lots and lots of issues and lots of scandals, and I think we need to do what other members have said and bring this all together, perhaps under one headline. To me, although I'm not a doctor, I don't have any doctor skills. I probably can read things when it comes to symptoms. I don't have any medical training. It would appear that this rate is significant enough that people should be fully informed of the significant risks before they are prescribed the medication, so it is embedded in their mind that there are massive risks with pregnancy and these drugs. I'm sure that many of us were supplied the briefing from the Epilepsy Action, and their statistics are hard to read, but they're very clear. But I would want to refer, if I could, just to one of some of the background, and thank Hansard as well for their very in-depth information they give us to prepare for this debate. I want to quote one thing from that, if I can. And they referred to the survey, because all members are referred, go back to 1995 and 96, where this was first mooted. There was a problem, and nothing really seemed to kick in to take action. And they referred to this survey as being repeated in 2017, when it was found that 18% of women taking the epilepsy medicine sodium valproate didn't know the risks this medicine can pose during pregnancy, and 28% of women said that they had not been informed of the risks of this medicine in pregnancy. How can that be that the lessons haven't been learned? Dr. Rise Thomas, Honorary Consultant in Epilepsy at the Royal Victoria Infirmary in Newcastle, said this is a dramatic and important survey focusing on a crucial area for women with epilepsy. And as a medical community, we clearly could be doing more and should be doing more. Even if women are being told of the risks, this may be at the wrong time for them or in the wrong way. So sometimes when you tell a story and you tell what the risks are, the way it's told isn't done in a way that they can even understand it, and that has to be wrong. So the conversation needs to be had, but it also needs to be repeated, and people need to be aware of that. And I'm not quite sure if that's been done in the way that it should. The Epilepsy Action and Statistics are as follows. Medicines and Healthcare Products Regulatory Agency figures suggest that up to 4 in 10 babies are at risk of development disorders if valproate medicine is taken during pregnancy. 4 in 10?
Yeah.
That's massive.
Yeah.
I mean, how can that be ignored?
Yeah.
Approximately 1 in 10 babies is at risk of physical birth defects. Babies affected by sodium valproate can have severe problems that require lifelong care and support. You know, are we looking at prevention? Are we looking at the future? Are we looking what the long-term care will be? I suspect we're not. It's estimated that 20,000 babies have been affected by sodium valproate, and total 400 babies a year are born to women taking sodium valproate. Epilepsy Action, Epilepsy Society and Young Epilepsy have conducted a survey of over 2,000 women with epilepsy and found that some women are still not aware of the risks of taking epilepsy medicine in pregnancy. More than a quarter, 28% of women taking the epilepsy drug have not been given information, as I said before. And again, conscious of your indication, and I'll come to the conclusion. Again, this would indicate to me that anyone who is on the medication should have taken time by a knowledgeable medical professional to go through the risks of being pregnant whilst on the drug. I know this, after you become pregnant, may well be too late. Therefore, the discussions with your GP are very important. It is not a matter of simply stopping the drug when you get a positive pregnancy test. This is not safe to do so. And I would urge, in conclusion, to follow the 8 points, but I say this: do the compensation fund that we all in this House want to see, because that will at least help those families deal with the financial positions that they're in. Mr Deputy Speaker, thank you.
I'm just going to bring Cat Smith, and if you could finish at 1:30, I'd be very grateful. And could we try and see if we can get about 9.5 minutes from the wind-up speech in order to bring in Norman Lamb. Cat Smith.
Mr Deputy Speaker, and it's a pleasure to be able to be squeezed into the end of this debate, and I will be very brief in my comments. This debate really started for me within days, actually, of being elected as a Member of Parliament in 2015, when my constituent, Janet Williams, got in touch and asked whether or not she could meet with me. And when I was first elected as an MP, I imagined I'd be meeting most of my constituents back up in Lancashire. But Janet, I think, was very keen to get a meeting in very quickly, and actually chased me down to Westminster, and I met with her in Portcullis House along with Emma Murphy, both of whom have been mentioned quite a lot in this debate, and I pay tribute to the work that they both do on this very important issue. And when I met Janet, to be honest, my jaw hit the floor. I couldn't believe that in this day and age we were still in a situation whereby women were being prescribed drugs which were harming their unborn babies, and they were not being told about it. But it wasn't just that they weren't being told about it, but frankly it was a cover-up. And I find this to be a national scandal, and I do not use those words lightly, because for Janet's sons, Philip and Lee, both of whom I've met and of course are my constituents too, this is a life sentence. And Janet should not feel guilty, for taking the drugs that her doctors told her to take during her pregnancies, but for her sons, they will continue to need care throughout their entire lives. They are 2 young men in their 20s, and that's certainly a huge social care need. Now, this scandal started in the 1970s, but as I've said, Mr Deputy Speaker, it continues today. Today, there are women in this country being prescribed this drug, which is a great drug. It's a very effective anti-epileptic fit drug. It's very good at treating bipolar and also migraines. But we need women to have knowledge. We need to share knowledge with women so they can make decisions over their own bodies and over their own health in pregnancy. So I would like to urge the Minister in his response to, and colleagues have mentioned this already, to respond to the call to publish prescribing data so that we know if certain areas of the country are over-prescribing this drug to women of childbearing age. And I would add my voice to the call for a public inquiry into this national scandal, and that we have an adequate compensation package for all those many people and their families who are affected by this national scandal.
Dr. Philippa Whitt.
Thank you very much, Mr Deputy Speaker. I again would like to pay tribute to the member from North Norfolk for getting this debate and trying to air this issue again. Epilepsy affects 1% of the population, that's 600,000 people. And it is not a trivial condition, it is dangerous. As we heard, 1,200 people a year die of epilepsy, and we mustn't diminish that. At the lowest level, if you have a fit after being well controlled, suddenly you can't drive again. That's quite a big impact on people, and at the other end, death. So we must be really careful that we do not send out a message that anti-epileptics are bad, or even Epilim. It works really well, and it is one of the drugs that is often able to control particularly the most dangerous seizures, the tonic-clonic or grand mal as it used to be called, with one drug. Almost all anti-epileptics carry risk. Now, sodium valproate is the worst by far, but all the ones that you've heard of in the past, phenytoin, phenobarbital, primidone, carbamazepine, they all carry some risk. So I think we have to recognise it's not just like the doctors prescribed the wrong drug. This is really hard to deal with. And what we need is that people have specialist input. And so what we're really asking for is that when girls reach puberty, until they reach either menopause or into their 50s, when there is no risk of them having children, that the decisions are made with them by specialists. Now, we've heard that obviously there was recognition right back in the 70s that there could be congenital abnormalities brought about by sodium valproate. But what appears to have changed is the scale. We see, if you look back, they talk about 2% risk of malformations and some possibility of developmental delay. What we see now is we're talking 10% of children with a birth defect, which might be something like cleft palate. It might be a minor cleft palate that can be dealt with. It could be right through to spina bifida that means that child is facing major physical disability. But on a much worse scale, 40%, almost half of them, facing some form of developmental delay that can mean autistic spectrum, learning difficulty, ADHD. And that is a big change. So what we have is the recognition, as one of the earlier members, and I've forgotten the name of her constituency, talked about the paper in '95 that started to really bring these cases together. What you have before that is predominantly case reports. Somebody going, oh, this is odd, I'll write it up. But you actually require that someone brings that together. And when we hear there's 400 babies a year being born since the recent attempt to deal with this, what you realise is, had the reporting system, the yellow card system, actually been working, where we might have had 500, 600, 700, 800 a year of these cases, that would have been spotted much more quickly. So the system failed utterly in recognising a pattern. And I would say that has to be reformed. I think if a woman gives birth to a child with a birth defect, or in the very early years, recognition of some kind of major developmental delay, and she's on a drug, I don't care what the drug is. I feel that should be reported. Because that GP may never have seen it before, may not recognise that this could be an association. But someone sitting in MHRA who's receiving 400 or 500 of them certainly ought to recognise that. What we obviously have going forward is how you actually tackle this. And I think one of the shocks is that the toolkit, having been put out in February 2016, as over the last years, this huge scale has been recognised. And that's the change, recognising the scale. To hear that over 2/3 of women have not received any part of it is incredibly disappointing. And I would have to say it's great that there's some marking on the packaging, but maybe actually more of that needs to be combined, because you're not then depending on someone remembering to hand something out or to pick something up. You're actually empowering that woman to say, oh, what's that? You've never talked to me about that. You're starting to have that both sides of the equation have the chance to remember and discuss it. We've predominantly focused on the use of sodium valproate in pregnancy and the results of that. But by the time a woman is pregnant, as the honourable member for, Strangford, I'm not doing very well today. 650 names is hard enough. Adding another 650 just does my head in. Anyway, mentioned that by the time the woman is pregnant, and knows she is pregnant, crucially, it is too late, because these abnormalities happen in the first trimester, the first 3 months, when the brain and spinal cord is forming, when the arches of the face are combining. And that's why it's particularly neural tube defects, brain function abnormalities, and cleft palate. And so many women leading hectic lives may already be 2 months pregnant by the time they finally know. And that means it's too late. So that's why the annual review is important. And if there are children on Epilim, and Epilim is perfectly fine to use in a girl if that gives good control for grand mal seizures. But it needs to be flagged up that when it is expected she's approaching puberty, these discussions need to start with her and her family. Family planning is important for all women. But for women on these kind of drugs that must be stopped in pregnancy, it's absolutely crucial. And so what we need is to have that discussion, to look at the alternatives. I would echo the comment about if a woman is pregnant and did not plan not to just stop the drug on her own, she should have emergency access to a specialist who is able to look at her type of epilepsy and discuss with her, would it be safe to just take nothing? Is it better to change to something else? But to recognise that to actually face uncontrolled seizures in pregnancy can cause you to lose the mother and the baby. And we mustn't have any kind of irresponsibility around not flagging that up. We had a debate in this chamber last week on baby loss. Again, a very powerful cross-party debate on the anguish that people face, whether it's early miscarriage, stillbirth, or neonatal loss. And we talked about that loss and bereavement. But any of us, whether male or female, who have had children, know the expectation and joy of waiting for a child. And therefore there is still exactly that bereavement when we know that our child is going to face a life of difficulty, of physical and mental difficulties, of learning disability. We know that a child with marked learning disability has only a 7% chance of working. So for the parents, the stress of knowing that there will come a point when they're not there, and how will their child, maybe now a young adult, actually survive facing a harsh world. So I think having financial support is absolutely crucial to give families peace of mind. I think we do need an inquiry, but I think rather than multiple inquiries, I think actually bringing some of these common themes together into one would be much more powerful to get people to recognise we are talking relentlessly repeating patterns. So let's try and reform the things that allowed this to happen, and let's make sure we support the families and the children to whom sadly it has happened.
Shadow Minister Sharon Hodgson.
Thank you very much, Mr Deputy Speaker. It really is an honour to be responding for the second time today in this chamber on behalf of the opposition. Firstly, I want to start by thanking the Honourable Member for North Norfolk for securing this very important debate today. It really is a much-needed one to finally discuss in detail and in Parliament, in the main chamber, the issues around Valporate and what the government must be doing to address this injustice. He spoke with such passion and obvious outrage on behalf of the thousands of women and children affected by this disgraceful scandal. I too want to thank the other honourable members who have taken part in this debate today, the Honourable Member for Congleton, Newport West, Eastleigh, Hayward and Middleton, Bury North, who gave an extremely moving account of how this drug helped him as a young boy, making the point that when used correctly, as we've heard, this can be a very good drug. There was also the Honourable Member for Strangford, Lancaster and Fleetwood, and the Honourable Lady who speaks for the SNP from Central Ayrshire. It's been a very good debate. As we've heard, the issues of Valporate and the effects it has on fetuses are not new. In fact, they span a significant number of years, going back as far as the 1970s and 80s, when the first cases of the effect of Valporate were documented. Even recent scientific research has shown that Valporate can have an impact on a child's life, including a study finding that 10% of children exposed to Valporate will be born with a major congenital malformation, 29% requiring additional educational support, and 6% being diagnosed with significant social communication difficulties such as autism. Whilst there have been some movement on making women aware of the risks of Valporate during pregnancy through the Valporate toolkit, as we've heard, there is still far more that should and must be done to support these women and their children affected so seriously by this injustice. The scope of this issue is serious. Data from 2010 shows that over 21,500 women were prescribed Valporate. Whilst not all of these women will have since been or plan to be pregnant, it is worrying that following the toolkit's publication, there is still not enough awareness of the risks, with 85% of patients not receiving the booklet and 90% not receiving the pharmacist's card. It's important that the Minister looks into this matter as a matter of urgency and ensures that more awareness is created to help address this lack of knowledge that could save so many innocent lives from being irreparably, thank you, damaged. I knew I couldn't say it, and I still put it in the speech. As part of this, would the Minister be minded to agree that the NHS should make it mandatory for every clinician prescribing sodium valproate to a woman or a girl of childbearing age to have